Hi guys, my name's Kate Camphy and I'm a physical therapist here at John Getz Physical Therapy. I want to talk about how to correct your hips when they go out of alignment and also how to maintain that. First, what we want to do is go over how to assess if your hips are off. So one, if you're having pain, this could indicate you have a pelvic misalignment. And so what you want to do is check to see if there's a rotation. So what I'm going to have you do is lay down on a flat, somewhat firm surface, and you're going to do one bridge. This just sets your hips where they are. So Ramon, if I could have you bend your knees up and then lift your hips up and down just once, and then relax your legs back down. And then what we're going to do is check, feel the ASIS. These are the little bumps right on the front of your pelvis, and you're going to see if they're off. Ideally, you want them equal. So when we go to check Ramon, he's higher on this side. So that means he has a little bit of a rotation here. And so what we want to do is be able to contract the muscles on the front of his left leg and on the back of his right leg. This will help correct that rotation. So what we're going to do is, going over that self-correction technique, we're going to have Ramon stand on the side of the table. He's going to put this leg on the top of the table. This leg is going to go on the floor. So now I want to go over how to correct the hips if they're out of alignment. Because Ramon was higher on his left side and lower on the right side, that means we want to contract the hamstring on his right leg and the hip flexor on the left leg. So he's going to get in the position where his hips are flat on the table. He's going to kind of rest down on the table a little bit, making sure his pelvis remains square forward and he's not rotating. Then he's going to slowly press up and at the same time try and drive his knee into the table and drive his right heel into the floor. He should feel a contraction in his hamstring and in his hip flexor to get that muscle co-contraction. He's going to hold that for 10 seconds and then relax. You want to repeat this about 3 times, 10-second holds, to help get that muscle contraction so you can adjust that pelvis. Once he's repeated that, then you'll lay back on the table and you'll recheck your hips to make sure those ASISs are equal. And now his ASIS look equal. So now we want to maintain this. So there are 2 exercises that I recommend to help you maintain that pelvic alignment. Number 1 is use the bridge that we saw at the beginning of the video, and you can use that as an exercise. So bend your knees up, and you're going to lift your hips up, keeping your tummy tight and squeezing the back of your legs to get the hamstrings and the glutes to contract, and back down. Good, and you're going to actually do this as an exercise. So what I would recommend for that exercise is about 10 repetitions and 3 sets. You can also add in 5-second holds to get a better contraction. The second exercise is the ab series. This is a 4-part series. Right now I'm just going to have Ramon demonstrate the first part of the ab series because this is going to help engage all of his abdominals. So you're going to bend both knees up and you're going to tuck your tailbone up to the ceiling and then lightly try and push your knees away. Keep those toes up to the ceiling too. Good. Lightly try and push your knees away, and you should feel your core start to shake a little bit, and this lets you know that your core is engaged. Try and get that tailbone up to the ceiling a little bit more. Yes, there it is, and there's the shaking. You look for that shaking, and you want to keep pushing, but lightly until that shaking stops. And then I'll have you bring your legs back down. So this is a great example of how to, 1, check your hips, 2, correct it, and then 3, how to maintain it.